Hey everyone, and welcome to today's explainer. I am so pumped to get into this material with you because we're about to completely flip how we view orthopedics and human healing. We usually think of bone medicine as this very mechanical structural science, kind of like carpentry for the human body, right? But what if I told you that to truly understand how we heal, we need to completely redefine who is actually doing the healing in the first place? Okay, let's dive into this.
All right, Section 1. Doctors don't heal bones.
Now, I know that sounds wild and totally counterintuitive, but to really grasp the core of this topic, we've got to shatter a universally held illusion about medicine. Let's start with a little history test. What do you think was the very first disease humans ever recognized and studied? Take a second to think about it. Was it high blood pressure? Maybe diabetes?
Nope, the answer is trauma. Broken bones, dislocations, animal bites. But what's truly fascinating is the why behind it. Orthopedics wasn't the first medical field because bones are the most important part of the body. It was first simply because the healing process is completely observable. If a bone breaks today and gets set back in place, you can see if it worked. You don't need complex, invisible theories. You can literally just watch the healing happen right before your eyes.
And that leads us straight to the absolute core thesis of our explainer today. Doctors do not heal bones. Life heals bones. Period. A doctor cannot magically force a bone to knit back together. A doctor merely creates the proper environment. They set the stage, sure, but it is the vitality of the patient, the actual life force itself, that does all the heavy lifting.
Which brings us to Section 2, the body and nature.
To truly understand this life force doing the healing, we kind of have to look back at the ancient framework of traditional Chinese medicine, which views humanity and nature as directly mirroring one another. Imagine your body is a natural landscape. The bones are like the mountains. They provide that rigid structural support, the framework holding everything up. The tendons, they're like the rivers, connecting everything, giving you flexibility, movement, and the flow of force. Just as a beautiful, balanced landscape needs both sturdy mountains and flowing rivers, your body needs aligned bones and flexible tendons to function. When trauma hits, it's like an earthquake just wrecked that landscape. The entire goal of healing is simply getting back in sync with nature's rhythm. So the really crucial point here is how we categorize these parts. We usually think of bone, tendon, and muscle as completely different materials, right? One is hard, one is rubbery, one is soft. But there's a profound shift in perspective here. They aren't different materials at all. They are the exact same underlying biological energy, often called qi in Eastern philosophy, just condensed at different densities. When this energy condenses super tightly, it forms hard bone. When it condenses a bit softer, you get flexible tendons. And when it condenses fleshy and full, it forms muscle. They are literally just three different outfits worn by the exact same life force.
And because it's all one interconnected energy, we need a way to measure it. Enter yin and yang. Now, seriously, forget any mystical magic you might associate with those words. In practical medicine, the yin and yang are simply a logical diagnostic ruler. Yang is excess energy. It represents a brand new injury that is acute, red, swollen, and hot. Yin, on the other hand, is depletion, a chronic, dull, lingering old injury where the energy has slowly drained away. It's a beautifully simple, straightforward way to instantly categorize exactly what the body is experiencing.
All right, let's move to Section 3, 3 stages of healing. Now that we know how to measure the injury, we can see how these natural principles apply directly to the physical timeline of your body recovering from trauma. Because healing isn't just some random process, it is highly structured. Stage 1 is cleanup. When you first break a bone, it swells up and gets inflamed. The body isn't even trying to build bone yet. It's aggressively sweeping out dead tissue and debris. Stage 2 is restore energy. The inflammation drops and the body is exhausted, so it focuses heavily on gathering biological materials and generating blood to fuel the repair. Finally, we get to stage 3, rebuild structure. This is where the new tissue matures and the bone structure actually solidifies. You cannot skip these steps. You simply can't force the body to rebuild while it's still trying to clean up the mess. Which leads us to Section 4, different paths, same destination. Now, you might be thinking, well, this is cool ancient philosophy, but what about modern surgery? As it turns out, modern Western medicine and ancient Eastern philosophy have arrived at the exact same conclusion. Modern steel plates and screws. They act as temporary scaffolding to let life heal. Modern orthopedics used to think you had to cast a bone so it was perfectly 100% immobile. Now, the standard is to use plates and screws to create a stable construction site and then encourage the patient to get moving as soon as possible. Why? Because movement stimulates blood flow and life force. That steel plate doesn't heal you. It just holds the building still so your biological workers can do their job safely. So, what is the doctor actually doing then? Well, there are 4 practical steps of medical intervention. First, stabilize the structure. Manually put the bones back where they belong. Second, improve the local environment. Use external treatments to reduce swelling so blood can flow. Third, provide systemic energy. Use internal nutrition to give the body the fuel it desperately needs. And fourth, allow time for rehab. Notice a trend here? All 4 of these are just support systems. The doctor is the assistant. Your body is the chief surgeon. And that brings us to Section 5, the limit of life.
This brings up a very sobering reality. If life is what heals us, what happens when that life force begins to run out? 100 years. That is the approximate natural limit of human life. Whether you're looking at ancient texts or modern biology, which literally tracks how our telomeres shorten every time a cell divides, human cellular division has an ultimate ceiling right around a century. This represents our regenerative reserve. Every single year you live, that reserve gets just a little bit thinner.
To truly understand how vital this reserve is, check out this amazing historical anecdote from the source material about the Zhangye cow horse. A young horse suffered a dislocated hip, a massive, devastating injury that humans simply aren't strong enough to just pull back into place. But a clever handler didn't try to wrestle the hip. Instead, as the horse walked, he waited for the exact right moment in its stride and cracked a whip right by the horse's ear. The sudden shock triggered a massive whole-body survival reflex. Every muscle clenched in perfect unison, and that internal biological force organically snapped the hip right back into its socket. The external stimulus just borrowed from the immense, deep well of vitality that the young horse naturally possessed. But what if you don't have that deep vitality left? Consider 2 real cases of elderly women who suffered identical hip fractures. The 87-year-old took a conservative route, no surgery, just basic support. Her bones healed slowly and she walked with a limp, but she survived and maintained her independence. The 84-year-old, however, underwent aggressive modern surgery. The heavy intervention, the anesthesia, the sheer trauma of the operation itself was simply too much for her depleted system. She developed complications and tragically passed away. Now look, this absolutely doesn't mean surgery is bad. Modern orthopedics heavily favors surgery to prevent bedridden complications. But this powerfully illustrates that aggressive intervention on a depleted system can sometimes completely destroy the tiny bit of regenerative reserve a patient has left. Which gives us the most important takeaway for any medical professional. The ultimate diagnostic question is not, where is the fracture, but rather, how much regenerative reserve does this patient have left? If you just look at an X-ray to see the broken structure, you are only seeing half the picture. The real diagnosis is figuring out if the patient's body actually has the energy to endure the treatment, and knowing when it is actually safer to just step back. So, as we wrap up this explainer, we can summarize this entire paradigm shift into the 5 true roles of a doctor. First, recognize life. Second, believe in life. Third, adapt to life. Fourth, protect life. And fifth, help life. Surgical methods and techniques, those are just tools, but true wisdom is recognizing that you are treating a living, breathing system that has its own ancient, built-in rhythm for survival. I want to leave you with this final provocative thought. The next time you get injured, or the next time you are trying to help someone else heal, ask yourself this. When you are healing, are you just fixing a structure, or are you nurturing life? It completely changes how we view our own resilience, doesn't it? Thank you so much for joining me in this explainer, and I really hope this gives you a profound new respect for the incredible vitality inside you.